Well, 40 years ago, Médecins Sans Frontières, or Doctors Without Borders, began providing medical care in Mozambique. Teams of medical professionals work together to respond to medical needs of people that are affected by conflict, by disasters, epidemics, and people that are generally excluded from healthcare. Doctors Without Borders projects run in more than 70 countries, including Southern African countries such as eSwatini, Lesotho, Malawi here in South Africa, as well as our neighbor Zimbabwe. And to unpack this further, we are joined by MSF Medical Coordinator in Mozambique, Ana Gabriela, via Teams. Ana, thank you so much for joining us. Welcome. Look, medical care began in 1984 in Mozambique. So what have been some of your major highlights, as well as talk to us about what the motivation has been since the 40 years?
Of course, thank you for the invitation. So yeah, we are celebrating these 4 decades of work in Mozambique. MSF has responded to medical and humanitarian needs in this country, mainly responding to the lack of access to primary health care, malnutrition crisis, cholera epidemics since the early days of our interventions. And then we got engaged in the HIV epidemic, of course, tuberculosis, malaria, neglected tropical diseases, and of course our response to emergencies, to natural disasters, mainly cyclones, floods, also the COVID-19 epidemic, and of course people displacement from their homes due to the conflict in the north.
I mean, let's expand on that. And we understand that you also give technical assistance to people that would be, denied access to basic things like your clean water, shelter. So talk to us about maybe the scope as well as level of involvement when you are called upon some of these regions.
Of course. So MSF, as you know, is a humanitarian medical emergency organization. So when we are called upon an emergency, we always have a multidisciplinary team. So this means we are not only doctors, we are a team of logisticians, administrators, medical doctors, health promoters, and a lot of people that make this possible. And we work hand by hand with the communities. This is also something important. We use an approach that we call patients and populations as partners. So we try to understand the needs also from the community, from the people, and then we try to design our interventions in all these areas. We try to empower communities to provide education, as well as, of course, provide the direct medical care. That is something that distinguishes us and makes MSF different to other organizations, as we provide directly the care to this population.
Now, your team's often called to unfavorable conditions. I mean, the country experienced a civil war between the Renamo as well as Frelimo groups. And more recently, Cabo Delgado, for instance, remains very volatile. So take us through some of the challenges that you've actually had to navigate through in that particular region.
So as you said, the security context is very volatile. This means that we constantly have to assess the security conditions before any of our movements, of our activities. But as well, this means that we need to constantly monitor the movement of the population to be able to assess the needs and the gaps for these people. There are certainly areas that we cannot access because of the insecurity and military operations. There is also an increased use of landmines that is an additional barrier for the populations to access care, but also for MSF to enable community activities and reach those populations in need.
Now, your teams are often also exposed to some of the traumas in some of these unfavorable conditions that we've just highlighted, Anna. So how are they finding ways to actually cope? And maybe talk to us about where the contingent of your staff is actually retained from.
So in the northern Cabo Delgado, northern Mozambique, we are still continuing our support in hospitals of Palma, Mocimboa da Praia, Moeda, and our teams are, well, we have a big team that supports the teams that are in the field. We provide psychosocial support to our teams as well, not only to the populations. We have a high level of security and context analysis that we put in place to ensure their well-being. As for now, we had to put on hold some of our clinics and mobile activities because of security reasons. So in summary, I think we are closely monitoring the situation. We are trying to see when and how we can resume activities, where we can perform other activities. But really, the volatility of the context is a very big challenge for us.
And also, Anna, I mean, the services that you provide in general, I mean, is medical care, which is often very expensive. And to also get it into these far-flung regions should also spell a challenge. So talk to us about where you get your funding.
So MSF funding is mostly private. It comes from private donors, individuals and private companies that are committed to MSF, believe in what we do, and they provide donations to MSF. And then MSF responsibility is to make the most use of these fundings, and that's why we perform activities directly. As you said, we have a lot of challenges as well in ensuring that we can access those population, that we find safe ways to bring our goods, our medications, materials, and our teams to those ones who need it most.
Now, yesterday marked World Against Child Labor. How did this play out in your work? Have you had any successes in changing this?
In Mozambique, not particularly. We have not had any specific role in this thematic, but there are so many other countries where we work that this is one of the challenging problems. MSF has also a big role in witnessing and performing advocacy for people that are more vulnerable. And in this sense, we always, when we have a role, we perform these advocacy efforts. We engage with community actors, with the authorities, and we address according to the situation.
Now you've got some really great stories to tell. And I mean, if I can just recall one, that child whose mother actually gave birth to him while she was clinging on a tree. I mean, give us some of those good stories, that you would like to share, albeit very briefly, with the viewers of this program currently.
Well, we have a lot of nice and success stories. I think that one was one of the most, let's say, mediatized, and it was quite impressive. But in our day-to-day work, we have stories of success. Right now, we are working with neglected tropical diseases, and it's amazing to hear the stories of the people that had been living for many years with diseases like lymphatic filariasis, elephantiasis, and they thought that there was no other way of living. And then with the care that we are providing, they can improve their quality of life, going back to work. But one specific story that I could mention, like actually in the ceremony that we performed for the 40 years. Before the beginning of the ceremony, someone approached to us because they saw the MSF flag, and he said that he used to be a patient of our advanced HIV disease activities 15 years ago, and it was thanks to MSF that he actually managed to overcome several infections and a severe HIV disease, and that he's nowadays very well and having a family. And I mean, this is always what motivates us to continue working.
Absolutely. Great news all around. Now, in closing, I want you to speak to these two. And 40 years on, what have been some of the continuous and pressing humanitarian issues that Doctors Without Borders is currently responding to? And also, any call to action? What more do you think could be done in order to ease the plight of those vulnerable populations, particularly in Mozambique, as well as other areas that you are in assistance?
Yeah, so right now MSF has projects in Sofala province where we are working with advanced HIV disease, in Nampula province where we are providing a community approach for neglected tropical diseases. As we have already discussed, we are working in Cabo Delgado for provision of primary health care to those displaced or without access because of damaging of medical infrastructure or lack of medical staff, and supporting hospitals. And in terms of emergencies, we are always prepared to respond to the major risk in the country, mainly cyclones, floods, and other extreme weather events, and cholera. Regarding calls for action, I mean, there is definitely a lot of things to do that we can support as partners, the Ministry of Health, in enabling access to health and better health care for vulnerable populations. We need to enhance our efforts to protect these vulnerable populations. And sustainable peace and stability is essential for this, but also empowerment of communities. I think we need to work more towards this. Also resilience of the communities, as Mozambique is highly exposed to these extreme weather events. We need to work hand by hand with the community. We need to be more prepared for disasters at all levels, from community to institutional to partner level. And finally, I could mention the strengthening of the Ministry of Health capacity to provide as partners more capacity building, more trainings, and to look for more partnerships between not only MSF and MOH, but other actors in the country that can give more sustainability to what we do.
And also there you assisted in, of course, providing information, as well as, of course, more information around the safe abortions for some of these women in some of these countries that we've mentioned above. Thank you so much, Ana, for taking your time to be with us this morning. That was MSF Medical Coordinator in Mozambique, Dr. Ana Gabriela, on its 40th key milestone anniversary of medical care in Mozambique.